As we've talked about many times before, health screenings can save lives. Just recently, our own Danielle Wiggins shared how self-exams and getting her mammogram as soon as she turned 40 detected breast cancer. She caught it early and has a positive prognosis after surgery, but some recommendations can be confusing. So as part of our Do It For Danielle campaign, we clear up some of those misconceptions.
Research has continually shown that early detection is the best defense against breast cancer.
Catching cancer early sets up a better chance to fight it. But conflicting information has women confused about what age to get that first mammogram.
And so Cleveland Clinic recommends that all women get screened starting at the age of 40 with annual screening mammograms, unless there's a significant risk.
Dr. Rachel Kaczynski is a breast surgical oncologist with the Cleveland Clinic, and those risks she's talking about?
Any family history of breast cancer in first, second, or third degree relatives, any family history of ovarian cancer or pancreatic cancer in any family member, any family history of breast cancer in a family member under the age of 50 years old.
Another risk factor, if you have a family member that has or had prostate cancer, something Danielle never knew but ended up being her red flag. Women who have also had biopsies of breast tissue and it came back with the word atypia also need a more aggressive screening program. Race can also be a risk factor.
There are certain populations of patients who are at higher risk for cancer in younger ages. African American population is one of those, and also Ashkenazi Jewish ancestry is important.
Anyone who falls into those categories should ask their doctor about a mammogram before age 40. And then there are those who find lumps early.
If I call and they say, okay, well, we can get you in 2 months, is that enough time, or is that a safe amount of time? Or, I know as a patient, I would be worried, oh my gosh, what if something's getting worse? Or, should I get in sooner? What happens if somebody finds themselves in that situation?
In general, breast cancer tends to grow pretty slowly unless it's a higher risk type. So waiting 2 months isn't necessarily going to be an end-all be-all, although anxiety-driven for sure. However, if it's something that's really growing fast, I would stress that you stress that importance to the person you're speaking to when you're trying to schedule that appointment.
The Cleveland Clinic has 7 walk-in mammography locations. The biggest risk Dr. Kaczynski sees anyone make, not getting a mammogram at all.
It's often anxiety driven. I think a lot of women are scared. They're scared of the unknown. And so sometimes they put off getting that screening mammogram because what they don't know won't hurt them. But it's very important to know what your breast density is, and that's always reported on your screening mammograms. And that's important also for your risk and whether you should be getting 3D mammograms or not.
If you're wondering what your risks are, there's actually an online calculator that the doctor told me about. It's bcrisktool.cancer.gov. You enter in all your information, you find out, and it can tell if you should be advocating for a mammogram before the age of 40. And it's also something you should just ask your doctor about. I know that my own doctor, who's with the Cleveland Clinic, and this, this came up as we were talking about what age, he wanted me to get a mammogram well before the age of 40 so that we would get a baseline and understand density and breast tissue and all of that. So really, it's about talking to your doctor and figuring out what is your best path to.
Yeah, and the Cleveland Clinic doctor was also telling me that they're thinking about pushing the age to 35 for Black women because, as the piece said, we're getting diagnosed earlier.
Right.
And so you really just need to be able on top of that because early detection is key. They're even catching it stage 0.
Wow.
Something you don't want to wait on. Danielle, have you heard from a lot of people that have said, hey, I have done this now because of this?
Yes, I have heard from a number of people that said, hey, I put off getting a mammogram, or my daughter did, and she did now because I've been on top of her to get a mammogram. So those are the best emails that I have received.
You're making such a difference.
Yep, she is. All right, thank you.